Welcome back, dear viewers. Dr. Eiman Alhashemi, MD, FRCPC, is a Canadian board-certified specialist pediatrician and pediatric intensive visit at New Jahra Hospital and board security of the Kuwait PICU task force. She's recognized for advancing Kuwait's first pediatric trauma program and for her role as quality improvement and patient safety lead. Her work includes simulation-based education, post-ICU follow-up initiatives, and a focus on system change, family-centered care, and improving outcomes for critically ill children in Kuwait. So it's all welcome our guest, Dr. Eiman Alhashemi, MD, FRCPC specialist, pediatrician, and pediatric intense visit. It's really a pleasure to have you. I know it's a long introduction, but the medical terms are really difficult.
I apologize for the many words that you had to mention.
No, I mean, it's not your fault.
Thank you for having me today.
But we have to practice, the medical terminology.
Of course.
So it's really amazing to see a doctor has a Canadian board certification. This is really. They are very expert in pediatric field.
That's very true. It's really a privilege and an honor to have trained within the North American healthcare system. Definitely, this is in accordance with the visionary leadership of Kuwait's Ministry of Health view and vision in order to advance the fields of medicine within Kuwait, and indeed. So I think this goes in line with that.
Indeed. Definitely fear of PICU and facts. Many parents are afraid when they hear their child is admitted to the PICU. Why do you think this takes place, this fear? And what would you like to tell them, or what would you like to let them know about this kind of procedure?
So I think it's an interesting question that you ask. Fear from the ICU. I think when you talk about fear, we need to understand the core of this fear. And so you might ask, why do they have this fear from the very beginning? So fear is usually linked with the unknown, or, for example, past experiences that might be detrimental. So when we think about the pediatric ICU in particular, we then ask ourselves, what do we do in the pediatric ICU? So the pediatric ICU is essentially a place where it's a specialized service where critically ill children, so children with life-threatening disease, would be admitted within the unit. And so what it entails, what it encompasses is a team, it's a whole team of pediatricians, pediatric intensivists, it's nursing, dietitians, pharmacists, occupational therapists, physiotherapists, so it's an entire multidisciplinary team. So the core of the ICU is teamwork and multidisciplinary involvement. And with that, the ICU is really, the concept of it is to take care and to really prevent long-term outcomes, poor outcomes in critically ill children. So when we think about the ICU, as soon as I tell someone or a family that the child needs to be admitted to the ICU, the initial response is, no, I do not want the ICU. And it's mostly related to past experiences. For example, if you've had someone, God forbid, you know of someone who's an adult who has been admitted to the ICU. The experience is such that most of the outcomes are quite poor. And so what we try to focus on in the pediatric ICU is that we have a different notion. The literature studies have proven that more than 95% of children who are admitted to the pediatric ICUs survive. And so now in modern ICU, pediatric ICU, we don't focus on just survival. We focus on preventing morbidity.
Yeah, so basically better diagnosis.
Correct. And so preventing
yeah.
long-term disability and long-term poor outcomes. And so we now focus on holistic care as opposed to just survival. So the concept, it's natural to be to fear the ICU.
Yeah.
But something I'd like to highlight to parents is that it's not really the same perception they have
for the adults.
Yeah, children are very resilient.
Exactly, and also I would like to add on top of that, Dr. Eiman, if you may, you know, it's good to be worried, but not to be, you know, panicking, you know.
Exactly.
Worrying about, you know, your kid, or this is normal and it's healthy, it's not unhealthy, but
exactly.
Going beyond that, it's not healthy. So common causes of PICU admission, like seasonal, as we approach the change of season, what are the most common illnesses or emergencies that bring children to the PICU?
So it's very timely that you asked this question. We are currently in the season where we see viral illnesses, right? Many of you might know, many families now are suffering from influenzas, colds. And so what we now see, it's starting around mid-October or the beginning of November, is we start to see viral illnesses. And by viral illnesses, specifically diseases like bronchiolitis, which affect the respiratory system, and pneumonias. So mostly it's around viral illnesses that then affect children, specifically those that are at higher risk and necessitate the admission to the ICU. So that's one thing, seasonal viral illnesses that predispose them to go into the ICU. And then there's other aspects, specifically now within the winter season. You might see, you know, kids going out for outdoor activities, going to the desert, camping, for example. So going on ATVs, buggies.
The buggies,
And so we tend to see some trauma as well.
Yeah, absolutely.
And so a lot of our care as well in the winter season is dealing with pediatric trauma patients being admitted to the ICU.
And especially, as you mentioned, the camping, you know, all these accidents, you know, takes place.
Exactly.
Definitely it leads to all these.
Exactly.
So post-intensive care syndrome, PICS, how can an ICU stay affect a child long-term even after discharge?
So I think the term you just mentioned is a very important term.
Yeah, that's, I know.
But what does that mean? So I think what people tend to understand is that as soon as the child is discharged from the ICU, that's it, you know, he recovers and should be okay. But what medicine and what advances in research has now identified is that term you just described, post-intensive care syndrome. And so what is that? It is essentially when a child leaves the ICU, there is a risk of the child developing physical complications, things like weakness. So the child will be in the ICU bed for a period of time, probably on some sedation. And so the child will not be moving. And so they come out with some weakness. The child might suffer from anxiety. They might suffer from post-traumatic stress disorder, anxiety, night terrors, and not just only the child, but the social aspects of care as well. The families might also suffer. So some families go home and they keep remembering and getting images. So a post-traumatic stress insult essentially happens to these families. And so the post-intensive care syndrome encompasses all of these complications. So physical, psychological, and social aspects.
Okay, good. So this is also part of the follow-up, you know, for the patient.
Exactly. And so the care of the pediatric ICU does not extend to the door of the ICU. It extends beyond that.
Beyond that.
And this is something that new advances that in medicine that we are now encouraging our pediatricians to look into as well.
Indeed, this wasn't, you know, this didn't take place back in the past. Definitely, it's nowadays procedures.
Exactly.
And really, thank you for that, because honestly, we need that. You know, we need, because I mean, I know although we are educated, but still, and medical-wise, we are illiterate. You know what I mean? Yeah, so we need the doctors always. So family-centered care, what does family-centered care mean in the PICU settings? And how do you involve parents in their care of their critically ill child?
So family-centered care is a term that we live by,
Okay.
is in the heart of our care in the ICU. And what does that mean? It means that parents are not just visitors. Parents are partners in the care of their children. And so what that basically means is that the care of the child is only whole with the presence of the family. So you might have this traditional thought of this is the ICU, the parents should not be entering, no one should be entering, the child should be there surrounded by nurses and
devices.
Exactly. Now, it has been proven evidence-wise that the presence of families, specifically the parents of children in the ICU next to their child, is actually healing. It promotes healing, it promotes recovery.
That's true.
And so in the ICU, we actually involve the families from the very beginning. We involve them in, being there for the child, even performing the daily activities, like if the child is able to feed, they would be involved in feeding the child as well. Being actively involved in discussions, shared decision making, meaning when I give a management plan, the family also has a role.
Their input. Yeah.
Exactly.
Yeah.
And so this is now, we have moved away from the traditional doctor doctor-initiated management plan, but we now talk about the holistic family-centered care.
Exactly. So involving the family, this is definitely has psychological
Definitely.
healing effect.
Yes.
Yeah.
Yes.
I remember one incident. I saw this family in front of me. This incident took place. A father and a mother, they left their child in the hospital, and you should hear the screaming of the child.
Exactly.
Wow, that was really dramatic. I felt sorry for that kid.
Exactly.
But that back then that was the procedure.
Yes.
But you should hear the screaming of the child. Believe it or not, it's heartbreaking. But this is really very, very beautiful procedure and really advanced, to let the parents involved in the healing of the patient. So, Dr. Eiman, teaching via simulation program, you also teach doctors and nurses through simulation. Can you explain what medical simulation is?
So, when you talk about simulation, let's go back a bit in history.
I know it's a simulator because I'm an engineer. So,
well, that's perfect.
Yeah, but we need to explain to our viewers.
Yes, exactly. So it first started with the aviation industry, right? So it goes back in the 1960s is when simulation first started. And the whole concept in the aviation industry, pilots would first start with flying a simulator before they flew passengers, right? And so this is then extrapolated into the medical healthcare system, where basically we take real life scenarios and simulate them in medical practice. So we create emergency scenarios, and in that scenario, there is no risk. Right? This is the time where the healthcare professionals can make mistakes. And this is when they learn, right? And so medical simulation and advances in medical simulation is really the cornerstone of emergency training. And so this is, we try in our unit to advance the medical simulation program in order to achieve confident and well-prepared physicians, nurses, a whole entire team.
You were trained for that during your residency?
Correct. Yes.
So that's
it was part of our training, and we are now trying to advance it in the sense of we now, with the advancements of AI, for example, we now have high fidelity simulation, where we now have mannequins that can cry, that can seize as well. They can scream, they can stop breathing, and it imitates real life scenarios so much that doctors nurses and the entire healthcare team.
They can discuss and see the procedure.
Exactly, and it trains them in in a real life scenario for the actual scenario, so that doctors and nurses are all well prepared. Nice. And this is the cornerstone of our education. We prepare them so that when the time comes, when the real seconds that matter, they are ready. Yeah.
Amazing. This is really beautiful. You know how advanced the medical and the patient-doctor relation are really nowadays. So first, a pediatric trauma program in Kuwait. We understand you have been involved in the first pediatric trauma program in Kuwait. Why was this program needed?
So as we talk about this, I would like to first thank the visionary leadership that led this program, the hospital directors, our head of department. That in essence, I think this has been a system change. So we recently, the Jahra team, the PICU Jahra team has recently won an award, a national award of a patient safety award, with regards to this specific project, which I don't think is a project, but I think it's a system change, actually. So pediatric trauma in the past, children who had accidents, for example, motor vehicle accidents, if they were deemed critically ill, meaning that they need the ICU, they would be admitted to adult ICUs. Oh. And so the concept, obviously, is not the same, right? In adult ICUs, so children are not small adults.
Exactly.
They have different physiologies. Their sizes are different. The way they function is very different.
You need an environment really suits its attitude and
exactly. And so based on this perception, and this is how healthcare has advanced even worldwide. We essentially have advanced the first pediatric trauma service, PICU trauma service in the country, and we've established excellent outcomes. So far, we've had a registry of 40 patients who have been admitted to our PICU, all of which have achieved excellent outcomes. The project has been presented to the Ministry of Health, for which we have received an award for. So it's honestly brilliant to see the implementation.
You are in Al Jahra Hospital.
Correct, yes.
So definitely you have a new big area, besides the resident area. Al Matla city will be also.
Yes. Yes. So we're going to start seeing more of them. Yes.
Yeah, and definitely I'm still building in Al Matla. So
God forbid we
want to visit you in a city, but not in a hospital.
Inshallah, inshallah.
So unfortunately, we are out of time. It's really interesting conversation, Dr. Eiman, and I want to go on, but we are out of time. So if you have any final message you want to convey for our viewers, it's your time now.
So I think I just want to highlight that the art of pediatric intensive care is honestly it's humbling, right? I think what we try to take the fragility of the patients. They come into the ICU, and they always humble us in their resilience. Children are very resilient, and pediatric intensive care is now advancing. We are at a state where we are now going nationally, standardizing procedures, and are actually seeking international collaborations at this point. So I see a very bright future for pediatric intensive care in Kuwait, and I see a bright future for children as well in Kuwait, inshallah.
And also I see bright future to our medical staff, all Kuwaiti doctors, males and females. Definitely I see real advance, and a bright future. Thank you very much.
Thank you very much.
Dr.
Thanks for having
Eiman.
me. Thank you.
That was the viewers, Dr. Eiman Alhashemi, MD, FRCPC specialist, pediatrician, and pediatric intense visit. We'll go for a break. Please stay tuned and don't go away. We'll be back.